Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Orko Mukherjee, your IT manager, and with few things, today's quiz competition program didn't occur as there were some issues from our end, from our IT end. We failed to do the things, means we failed to just do the things on time, so that's why we couldn't conduct that quiz. So from next on, there will be two. I will hope there will be two winners on the backstage. We will talk about that and we'll let you know on the Telegram common group discussion. All the links are given in description. So without wasting any more time, let's just jump onto our 30 seconds countdown time.
Good evening, everybody. Good evening, sir.
Good evening. Very good evening to all of you.
Good evening to all our respected viewers who are watching live and will be watching on the later part of this program in YouTube. We have started long back, and today we are going to host the 87th episode of Continued Medical Education program organized by National Institute of Homeopathy Alumni Association. And today we are proud to announce that we are connecting extreme north from Kashmir, our speaker tonight, who will be introduced by our inaugurator from extreme northeast, Sikkim, and our moderator is from Delhi. So this is a beauty of online CME. We are getting at the same time all the three renowned personalities of homeopathic fraternity, and that also on one screen at the same time. So, without wasting further time, with your permission, Kalyani sir, uh,
Sure.
can we call on tonight's inaugurator, Dr. Ashok Kumar Singh, a very dynamic personality during his student days of UG at NIH, and now one of the topmost successful practitioners of the state of Sikkim. And I'm proud to host and call on tonight's virtual screen Dr. Ashok Kumar Singh from Sikkim to inaugurate tonight's session. Welcome, Ashok.
Welcome
Hello
very much.
everyone. Good evening, Bidyut. Good evening, Kalyani sir. Hello everyone. Good evening to you all. First of all, let me introduce myself. I am Dr. Ashok Kumar Singh of 4th batch BHMS, and I have been practicing homeopathy for the last 25 years, out of which last 23 years I've been practicing in Gangtok, Sikkim. So for today, I have been asked to be the inaugurator of the online CME, that is the 87th on the trot of NIH Alumni Association. It's indeed a great honor. And the topic for today's CME is homeopathy, a hope for prostatomegaly patients. Well, prostatomegaly, as we all know, is a very serious and very common issue when it comes to male, especially after the age of 40 throughout the world, irrespective of country, religion, and race. I am sure every one of must have encountered patients of prostatomegaly in our clinics and hospitals in our day-to-day life, and hope everyone has lot of success in treating those cases. When it comes to homeopathy, I believe homeopathy outscores allopathy in the treatment of prostatomegaly patients. So, wasting no further time, I would like to introduce the moderator and speaker of today's program. The moderator of today's program is very intelligent, brilliant Dr. Pritha Mehra. She is serving as Research Officer, Scientist 3 in CCRH at New Delhi. And the speaker for today's program is young and dynamic Dr. Javeed Iqbal. He is serving as Senior Medical Officer, Government of Jammu and Kashmir. So I hope you all join to today's program, and hope this program enriches your knowledge further. Thank you so much. Over to you, Dr. Pritha.
Thank you so much, Dada, for introducing me as well. Uh, Good evening, everyone. And uh, as Ashokda has already told about me, and I'm the moderator for today's CME session. Uh, Already highlighted by Dr. Ashok that prostatomegaly patients, they suffer from various symptoms which may be very bothersome for them, like getting up even at night and getting sleeplessness and all that, and frequency of micturition, not able to evacuate completely, bladder evacuation is incomplete, and all these things. And of course, our speaker today, Dr. Javeed Iqbal, with his being a senior medical officer, with his all uh, uh, experiences and whatever he has cases he has treated. Let's go and listen to him right away. Thank you so much, and I welcome Dr. Javed to the CME and continue with his presentation now. Thank you.
Thank you, Dr. Pritha. Hello, am I audible to him?
Yes, sir, you are audible.
So kindly guide me the PPT presentation so that I can make it visible on the laptop, please.
Okay, so basically, can you see the share button over there?
Share button, share. No.
There may be a share button. Please check once. And may not be a share, but a present, like an upward arrow type.
Present is there. Present plus is there.
Hmm. Just click on that, sir. And then there will be slides.
Yes.
Just click on that slides.
Uh,
Then go to my computers. Then all you have to do just find the source of your PPT. And from
so
there,
I have to
just
go to
upload it.
my computer.
Computer.
So I can minimize this.
Sure. You have to go through that. You have to click on that computer.
So it's on my
What
desktop.
you basically what you are seeing right now after clicking the slides, sir? Can you just please
Nothing.
narrate? Oh, nothing. Then all you have to do, sir, you just go to again. You click on the present, that arrow part. Then click on share screen, like screen. It's written the second option, screen. Are you able to see it, sir?
I have lost you.
Sir, am I audible? Can you hear me properly, sir?
Basically, I will be. So,
Please click on that present, means the arrow button, if possible, sir.
I'm clicking on the present button.
Click on that present button again.
So there are slides.
Okay. It's open. I guess it's opened, I guess. No, a second screen has opened up. Maybe you have opened two web, means two account, means two tabs, I guess. That's why it's showing two tabs, means two pictures of you. Just close one of the tabs, if possible. Sir. So now let me just guide you with again with the same process again. Just click on the present, then don't click on slides.
Uh-huh.
Or else just click on the second option.
video.
No,
It is
not
video
video.
file
Then
and
on the
share,
third, what's it?
share screen.
There will be three options, right?
So share screen is one of the option.
Share screen.
Yes.
Then there
So
will
should I
again.
once again click on
Yes,
the
yes,
share
yes. Just
screen?
click on the share screen. Click on the share screen. Now what you are seeing, sir?
It is Microsoft Edge tab, Windows, and entire screen.
Entire screen. Click on that entire screen. Click, sir.
I have clicked now. It is once again.
Now you are seeing a small miniature version of your screen on the white space, sir.
Exactly.
Click on that. And now click on share. The screen has been shared. And now you can minimize the minimize Chrome and open your PPT.
Is it on the screen?
Just put on the slideshow. Then I will just bring it up on screen. Just put on the slideshow. Then I will bring the screen up on screen.
Okay. So it's on.
It's on slideshow, right? Now it's on your screen. Just click on the hide button, sir. It will be best. Can you see the hide button right beside the story? Now it's okay. Now it's okay. All over to you, sir.
Okay. Should I start now?
Sure, sir. Sure, sir. Whenever you are ready.
So should I start?
Yes, sir. Yes, sir. Whenever you are ready.
Okay, I am ready. I can go with the slides.
Yes. Start, sir. Please start, sir.
Okay. Respected Kalyani sir, our president, NIH Alumni, Dr. Bidyut Mukherjee, General Secretary, my today's inaugurator, Dr. Ashok Kumar Singh sir, and Dr. Pritha. Good evening, everybody. Today we are supposed to have a CME, or I can say a talk on the Prostatomegaly. Prostatomegaly, definitely a men's health issue. Now, let me start with some of the fascinating, sorry, I can't say fascinating, but the facts that usually irritate us in the later stage of our life. Quoting goes like this: all his life he slept like a stone, but now there is an annoying trip to the bathroom every night, sometimes once or twice a night. They can't sit through a meeting or a plane flight without getting up, says Kiran Selevan, MD, a professor of urology at Baylor School of Medicine in Houston. It's very annoying, and when they have to go, they really have to go. They can't stop it. They can't wait. So whenever they are in a meeting or anywhere, they have to rush the bathroom once they feel urge. And the culprit remains the hypertrophic prostate. Before going through the prostatomegaly or the pathological process, treatment, and all the things that we are supposed to do with the patients of the prostatomegaly, let me first of all, let's try to understand this little creature within our body, or I can say a little gland, because first of all we must be knowing the pathology, this physiology, anatomy, then it comes a pathology, then it is the treatment. So before going to treatment, let's see what we are supposed to treat, what we are supposed to correct. So correct form of the prostate, what it should be, what it has to be in a normal phase in a body, so that it cannot make us suffer. So let's see something regarding the prostate. The prostate is a walnut-sized gland located between the bladder and the pens. The prostate is just in front of the rectum. The urethra runs through the center of the prostate from the bladder to the pens, letting urine flow out of the body. Now, what are the functions of the prostate? Prostate gland secretes a thin milky fluid that contains calcium, citrate ion, phosphate ion, a clotting enzyme, and a fibrinolysin. The vaginal secretions of the female are acidic, slightly alkaline. Prostatic fluid helps to neutralize the acidity of the other seminal fluids during ejaculation, and thus enhances the motility and fertility of the sperm. So you can see from these lines that prostate is very much important for the reproductive functioning of the body, both in males and females, because the alkaline nature of this fluid that is secreted by the prostate helps to neutralize the acidity of the vagina. Now let's see the surgical anatomy, because it's very much important. But it's a part of the prostate that is involved and has the different types of the symptoms. First of all, peripheral zone, which lies mainly posteriorly and from which most carcinomas arise. ये peripheral zone रहता है जहाँ पे हमें ज़्यादातर we can see the carcinomas of the prostate. They usually generate from that site. Central zone, which lies posterior to the urethral lumen and above the ejaculatory ducts. There is also a peripheral transitional zone from which most benign prostate hyperplasias arise. This peripheral transitional zone is very much important, because this area usually gets hypertrophy, which we usually call middle lobe hypertrophy, that pushes or that constricts the urethra, which is responsible for improper emptying of the bladder. Now, the fascinating fact about the prostate remains: whosoever gets old gets prostatomegaly, at least the maximum. According to the National Kidney and Urological Disease Information Clearinghouse, the most common prostate problem for men over 50 is prostate enlargement. After 50, most common problem. By the age 60, over one half of men who have BPH. By the age of 85, the number climbs to the 90%, according to the American Urological Association. Now, why there is, because it has been seen 0.02 mm prostate usually there is increase the size of the prostate after the age of 45. Why it happens? There's a reason behind it, that serum testosterone levels slowly but significantly decrease at advancing age. However, levels of the estrogen steroid are not decreased equally. Testosterone gets down, but estrogen doesn't. According to this theory, the prostate enlarges because of increased estrogenic effects. It is likely that the secretion of the intermediate peptide growth factors plays a part in the development of the BPH. Now, after getting prostatomegaly or benign hypertrophy of the prostate, because we are discussing here benign hypertrophy of the prostate. For the malignancy, we can have sometimes separate seminar. So in this seminar, we will be discussing only the benign hypertrophy of the prostate, which I can say is sometimes a physiology within the human body. Now, what are the symptoms once a prostate gets enlarged and your middle lobe enlargement is there? That constitutes the urethra. A weak or slow urinary stream, a feeling of incomplete bladder, emptying, difficulty starting urination, frequent urination, urgency to urinate, getting up frequently at night to urinate, a urinary stream that starts and stops straining to urinate, continued dribbling of the urine, returning to urinate again minutes after the finishing. Now, clinical examination. For these patients, once you are a percussion or palpate the abdomen, you will see distended bladder. For many reasons, you have to rule out external urinary meatus. It should be examined to rule out stenosis, epididymitis, or palpated to see signs of the inflammation. Rectal examination. This is very important examination to get initial initial view of the initial understanding of the prostate, whether it's a normal hypertrophy or there are cancerous growths. Because in benign enlargement, the posterior surface of the prostate is smooth, convex, and typically elastic, but the fibrous element may give the prostate a firm consistency. Here you can see once there is irregular surface with hardening, you can suspect the carcinomas or CA of the prostate when there is irregular. Otherwise, it's smooth and convex shaped. Now, what are the laboratory examination? Levels PSA, prostate specific antigens are being checked to see the malignancy, because usually the prostate secretes PSA, which is very much important to liquidate, so to liquefy or to keep the prostatic fluid liquefied. Otherwise, it will get coagulated. So levels below 4 nanogram per liter are usually considered to be normal. About 10, they are very much high, and 4 to 10, they are. Now, why this PSA increases? There is a study that has shown that the carcinogenic cells of the prostate secrete more PSA. That's why the level in the blood of the PSA increases in the patients who are suffering from the CA of the prostate. Now, one of the fascinating facts about it that we should not get confused only with this examination, because it has been seen the patients who are taking sexual stimulant drugs, they can be having an increased level of the PSA, and in case of the lower urinary tract infection or prostatitis, you can see an increase in. So before getting to the conclusion, we must rule out these two things. In a male, we are checking for PSA. Now, urine culture is done to rule out the infections, lower urinary tract infection. Dipstick, that is, you can see the patients with chronic kidney disease or diabetes have a frequency of mixation. So dipstick test can be done to rule out the diabetes, or we can go for the CKD, this ruling out of the CKD. Urinary flow rate and residual volume measurement, pressure flow studies. These are the investigations that are being done for the prostate enlargement. Now, imaging prostate. Now, here I want to say that prostate, we have to see, in USG, we get two things. One is that the size of the prostate, and second is the grade of the prostatomegaly. Now, size, you can have an increased size of the prostate and still symptomless, because in case of middle lobe, if the middle lobe is not enlarged, it will not affect your this urination. And second thing, you have to see grade. Grade means how much this prostate is pushing your bladder back, because it is irritating it now and then, and we get frequency of mixation, more frequency of mixation. That is being calculated in 5 mm. If it is pushed by 5 mm, it is grade 1. If it is pushed by 5 to 10 mm, then grade 2. And if it is pushed more than 10 mm, it's a urinary bladder that is pushed by the enlarged prostate. That irritates it, and continuously there is frequency of mixation in the patient increase. Post-viral residual volume, it has been seen that, which is a fact also, that less than 100 ml is very much acceptable, while a volume of generally considered more than 100 ml considered as an acceptable result of bladder retaining. So above 100 ml, that means patient can have sometimes a retention of urine. Now, a cystourethropy is done. It is usually done to exclude a urethral stricture a bladder carcinoma, and occasional non-opaque vesical calculus before going for prostatectomy. These can be the reasons for the retention of the urine. Transrectal ultrasound scanning. It is not necessary to be done. It is being done, but you can get a good view from trans-abdominal ultrasound, and rectal examination can be digital to see the this consistency of the prostate. Now, differential diagnosis before going for a prostate for the benign prostate, we have to see cystitis, prostatitis, prostatic abscess, carcinoma of the bladder, foreign bodies, prostatic cancer, bladder stones, bladder trauma, even stone in the urethra can sometimes block, or there is retention of the urine, bladder trauma, interstitial cystitis, urethral stricture in males, urinary tract infections in males. Now, before going for the homeopathic treatment or homeopathic management for the prostate, let's see what the other system or allopathy or surgical side has to do with this prostate increased prostate size. Acute retention in fit men with no other cause for retention. These are the indications for the prostatectomy. Chronic retention and renal impairment, a residual urine of 200 ml or more, hemorrhage, elective prostatectomy for severe symptoms. These are some of the indicating symptoms in allopathy for the prostatectomy, the removal of the prostate whole or in piecemeal. Complications after surgery. Now, as already discussed in the physiology of the prostate, it's very important organ, a very important male sexual organ. So, what are the there is importance incontinence of the urine, retrograde ejaculation of the semen into the bladder rather than through the penis, the need for a second operation in 10% of the patients after 5 years due to continued prostate growth or urethral structure resulting from surgery. In case of acute retention, urinary catheter is inserted through urethra, or severe cases suprapubic catheter is inserted into the bladder to empty the bladder. Drug therapy, alpha blockers are being used to soften the muscles around the urethra so that urethra can get rid of the pressure of that prostate hypertrophy. Prostatectomy is more severe in more severe cases of ruling out other cause for the urine retention. Now, let's come to the important part of this today's seminar. Now, we have discussed all the parameters of the prostate, anatomy, physiology, pathology, and allopathic management. Now, let's come to the main, that is homeopathy. What homeopathy has to offer for the BHP patients. Now, if we talk about the miasm, so miasmatic analysis goes towards psychosis, mostly the psychosis in the background of the benign hypertrophy of the prostate. Now, commonly used homeopathic drugs are supracellular. You can see mostly used. Highly efficient. Even some research in the CCRH have, or in other parts of have been done on supracellular. What are the symptoms that usually indicate for the supracellular of unquestioned value in prostatic enlargement? Epididymitis, where there is epididymitis and urinary difficulties. Constant desire to pass water at night, chronic gonorrhea. So the patient can have the infection or cystitis with prostatic hypertrophy. Conium is one of the drug recommended homeopathic for the prostate enlargement when urine flow is interrupted. Much difficulty in avoiding, it flows and stops again. Lidum. Interrupted discharge, also seen in clamates. Great difficulty in avoiding urine flow intermits, then flows again. Prostatic affections. These are symptoms that correspond to these drugs. Lycopodium, pain in back before urinating. Seizures after the flow. Slow in coming. Must strain. Retention. Polyuria during the night. Heavy red sediment. Enlarged prostate. Clamates is one of the great remedies that has proved its metal in the treatment of this prostatomegaly. Much difficulty in avoiding it. It flows and stops again, like lidum. Interrupted discharge, climates. Great difficulty in avoiding urine flow intermits, then flows again. Thuja. Thuja stream split and small. Sensation of trickling after urinating. Frequent micturition accompanying pains. Desire sudden and urgent, but cannot be controlled. Prostatic enlargement, like ferrum, pick, iodine, or subble. Sensation after urinating as urine trickling in urethra. Severe cutting at the close of the urination. Chimophila, smarting in urethra from neck of bladder to meatus. Cleat, loss of prostatic fluid, prostatic enlargement, and irritation. Digitalis, continued urging in drops, dark, hot burning with sharp cutting or throbbing pain at neck or bladder, as if a straw was being thrust back and forth. Very painful condition. Very painful condition. Worse at night. Straw urethritis, phimosis, strangling, full filling after urination, constriction and burning, as if urethra was too small. Brick dust sediments. Pasta, late stage of gonorrhea. Stricture, urine passed only in drops and stream interrupted. Acute prostatitis, pain and tenesmus in urinating. Worse lying on back. Now, repertory. I have chosen some single drugs in this Kant's repertory. Single drug rubrics, I should say. Kant is a separate chapter for prostate gland in urinary organs section. Now, these are single drug rubrics. Prostate urinary organs enlargement, dribbling urine after stool and urine. Selenium. Festering sensation, cyclinum. Prostate jarring aggravates, belladonna. Riding aggravates, staph. Standing, pain standing, cyclomen. Coition during, pain, pressing, coition during alumna. Pressing, nose on blowing alum. Pain, pulsating region of bovista. These are the single rubric medicines that are being shown in the Kant's repertory, if you go on the particular pathological symptoms. Now, boric has a prostate in male sexual system. Here, prostatic gland, these are some of the rubrics in boric repertory. Congestion, cantharis, conium, gelasium, pulse, subble, thuja, hypertrophy. There are so many medicines, beta carb, benzoic acid, ferrum pic, gelasium. So, picric acid, pulse, subulcer. Males inflammation में eps, cantharis, Chimophila digitalis. These are being in the Borix repertory. Now in Boger-Boning's characteristics, we have prostate gland, separate chapter, prostate gland, burning in Mitita Badka by A.M. Chaudhary sir. So prostate is a different separate chapter. Now, let's see some of the clinical studies that have been done on prostatomegaly. One of the study that was published by in Indian Journal of Research in Homoeopathy, Volume 4, Number 4, October 2000. It was done by CCRH. After comparing pre and post treatment results, the difference in men mean volume of values of IPSS, International Prostate Score, prostate weight, PSA, and average flow rates were found statistically significant. Maximum flow rate and post-voidal digital urine, PVRU, were found improving but statistically not significant. It was seen in patients who were given, 15 patients who were given lycopodium, 11 in pulsatilla. In sulfur, there were 8 patients. 3 patients have calcarea cough after improvement. were found to be most useful among 10 medicines prescribed. Results obtained from the study are encouraging, with findings that 93% of the patients improved clinically with an evidence of positive change in the diagnostic parameters. However, such study with randomized control trial is needed to further validate the usefulness of the homeopathic medicines. Second study was published in Indian Journal of Research in Homeopathy 2012. This was a multicentric prospective observational study done by the Central Council for Research in Homeopathy. It was at different these research centers, Guwahati, Delhi, Lucknow. So the collected result was data was available of 180 patients out of 231 enrolled was analyzed. The non-parametric Friedman test was applied to test for significant difference in AYUSH score reported over 12 months, baseline 3 months, 6 months, and 12 months. There was a statistically significant reduction in AUASI, American Urological Association Symptom Index score. The total 10 out of 20 predefined medicines were prescribed to 187 patients. The medicines found to be most useful in this study are Thujain 27 out of 53, Sulfur 26 out of 46, Pulstar 34 out of 46, Lyco 7 out of 13. There was a mean reduction of 2.3 ml in prostate volume, which was significant statistically. P-value was 0.005. So this was the conclusion of the study. Homeopathic medicine significantly improved lower urinary tract symptoms in men with BPH. Placebo-controlled trials are needed to evaluate the efficacy of the effectiveness. Now, let's come to the one of the most, what I see, what make me to present this seminar today on prostatomegaly was a case that I encountered in NIH while my PG. A patient named A.M.A, age 70 years, from Newtown, Kolkata, came in OPD number 11 on 24/04/2015 with complaints of retention of urine with suprapubic catheter inserted for last 2 months. There was burning in urethra. He has right-sided inguinal hernia. He was hypertensive for last 10 years and was taking allopathic medicine, amlodipine 5 mg. After case taking, following symptoms were taken for the repertorization. Patient has dies for company, weeping tendency, consolation gives sleep and feels better. He was worried about the financial instability. Chilly patient and has desire for sweet and fried food. Patient was thirstless and sleepless. This is the beauty of the homeopathy, because we usually go for the individualization rather than going for the particular symptoms or pathological symptoms or general symptoms. And what I have personally seen, on the totality, I should say, the medicines work more. No doubt, we have some pathological medicine like subulcer and other things. They can give the temporary relief. But if you need a much desirable result or a long-standing result, one has to rely on the individualization, because that is the beauty, and that sounds better in homeopathy. Now, these were the symptoms, and clinically the investigations were done. Prostate was 43 grams. It was enlarged. Urine had pus cells, RBCs, epithelial cells were like this. KFT was normal. Blood sugar was normal. CBC was normal. Now, these were the symptoms that were taken for the repertorization. Mind, desire for company जो हमने अभी बात की थी, mind weeping, consolation emulates, mind anxiety, money matters, about stomach जो थी वो sweets के लिए. These were the 9 symptoms that were taken from the patient and repertorized through radar on Kant's repertory. So different medicines came out, and Pulstar was having the highest score. So we thought, okay, we should start with the Pulstar. Patient was with Pulsar 0/1 OD and was advised to take plenty of fluids. Case continued. follow-up में हमने देखा burning in urethra felt in the morning but was better as the day progressed. Pain over suprapubic catheter area better. Patient started passing urine through urethra while he was going for stools. Clip of the when this symptom was seen in the patient, we decided to go for the clipping of the catheter. Let's see how because the catheter was suprapubic, it was not intraurethral, it was suprapubic, so we could afford to clip the catheter. This was a positive thing in this case. After clipping catheter, patient was passing urine normally. There was no burning. The suprapubic catheter, this was the follow-up on 8/5/2015. Suprapubic catheter was removed under the proper antiseptic cover. And treatment was the same. Pulsatilla 0/3. Urine examination was done. This was normal. Patient is feeling better on 12th May 2015 and improved with respect to all of his complaints. The suprapubic wound left after removal of the catheter has healed up. Patient is discharged from the hospital with advice to report back after 1 month. Pulsatilla 0/2 was given. This sound still soothes my ears because no doubt for last 3 years I had not got a call from that particular patient. I don't know what has happened, but for 5 years, 5 years after being discharged from the hospital, whenever I got a call from that patient, he always say, Dr. Babu, ami 22 number bed bolchi, because he was admitted in IPD in male ward on bed number 22. I will not disclose the name because that is some that has got some ethical issues. But he himself say ki I'm bed number 22. And once I had a presentation at this NIH Calcutta, I got him to that, and he himself narrated whole story after 3 years in the seminar hall of NIH. What has happened? And one of the beautiful thing about that patient was he was about 80. And once he went back, he started working once again. He was earning his better and better. This was what got me the ultimate feeling and satisfaction. With what I say, the firm belief on my system that miracles do happen. And if they happen, homeopathy is not the exception. Homeopathy has so many miracles to make. The only thing it needs our dedication, sincerity, consistency, sincerity towards our profession, hard work. And ultimately we can make these miracles happen with the passage whenever. Because I believe myself that there are 3 things that can make you perfect and that can make you satisfied. That's or successful, I should say. Hard work, consistency, and sincerity towards what you are doing. This is a discharge certificate of that. Now you can see the Manurajan Adhikari on the screen. He was discharged. This is the discharge certificate that was from the NIH patient. Now I have started with the name to this seminar that homeopathy, a hope for the prostatomegaly patients. Why I used hope? There's definitely a meaning for these 4 alphabets of the English language. For me, hope means homeopathy outplays prostatic enlargement. These are the reference I have gathered this data from. Thank you all for the patient hearing. I hope I have done what I could, but there are certain things I have to improve myself. And who other than you people, my seniors, my colleagues? If ever I had made any mistake or anything that is to be improved, kindly inform me, kindly convey me, so that in upcoming seminars I can make it more better. Thank you all.
Am I audible?
Yes.
Yeah, it was really a very, very nice presentation wherein you have covered all the components starting from the need to understand this topic and how we can uh, do good to our patients who are suffering from prostatomegaly, whether it is a simple prostatitis or it's a enlargement of the prostate as a whole, or even to the extent if it is like going to a cancerous stage where we can prevent with the homeopathic medicines. That's what I believe. And the best thing was that you have touched on all the aspects, like all the investigations, examination part, which is very much required. See, homeopathy, being the moderator, I'm taking this leverage to go a little ahead of this. See, in scientific world, they always ask for the evidence. So if we talk about only about the symptoms, and the symptom scores which are available, whether it is from the American Urology Association, prostate symptom score is there. There is an International Prostate Symptom Score, IPSS, which you talked about in one of these studies of the council, CCRH. And so the symptom score can be manipulated, as they say. But when you talk about the investigation part, when you are getting the ultrasound done for the patient, pre and post your treatment, the post void urinary volume which is left, like when the patient came to you, what was the volume at that point of time, what was the status of retention of urine in the bladder even after voiding the urine, and after your treatment how those things have improved. So these are the evidences which we need to keep with us always, and whenever we are documenting such cases. You have mentioned about two of the studies of CCRH, and that was way back till I think 2012, what you told, or 2000,
12.
yeah, 2012. Yeah. So after that, there was another study which was done. It was the homeopathic treatment for lower urinary tract symptoms in men with benign prostatic hyperplasia. It was an open randomized multicentric placebo-controlled trial. This was one of the RCT which was published, I think, in 2018 subsequently. And in this, I would like to tell to the audience as well that in this, there were three groups which were taken. In one of the groups, only the homeopathic constitutional medicine was prescribed to the patient. In the other group, as we all say, Sabal ceruleta or Hydrostis mother tincture, or few of the mother tinctures are also used, which are organ-specific remedies, which many of the homeopaths they use. So we took one group wherein the homeopathic constitutional medicine, along with the this organ-specific remedy, was also given, and in the third group, only the placebo was administered. So I'll just give a brief about that study. That the result was that the homeopathic constitutional group and the homeopathic constitutional group, along with the organ-specific remedy, they showed similar results. So again, this thing has been confirmed that if the doctor, if the physician is very clear what is the constitution of the patient, he is able to extract all the symptoms, all the findings, mental, physical features of the patient, and with the better understanding can prescribe the constitutional medicine, it will act wonderfully. And the organ specific remedy has not done too great in this study. I'll not be prejudiced about this, because there are many homeopaths who are doing wonderful prescriptions with mother tinctures. Our Praleda is one of them, I believe. So so concluding on this, Dr. Iqbal, definitely you have done a wonderful job, and I do believe that your description of hope, you will keep this for your patients whom you are treating in your uh, wellness center in Jammu and Kashmir, and all the best. That's all from my side. Over to Dr. Bidyut, Dr. Ashok, Dr. Kalyani, sir, please.
Thank you.
Thank you. Thank you, Dr. Pritha, Dr. Javeed Iqbal, Dr. Ashok Kumar Singh. Brilliant presentation. Really brilliant presentation. This is what less theoretical, put some practical things, and certified by other doctors, specialists. Reports of the Javeed Iqbal was certified, signed by some phonologist. He is not homeopathic doctor. This is one thing. We want to be certified by other specialists. Very nice. So just little thing I want to add, that we learn from our teachers in very early life that taste homeopathy in your IPG and OPG. Go back to your own field in life and carry on striving on the disease. Once you get confidence that disease can be cured, a incurable or difficult cases which is getting cured in OPD and IPD, be sure that these cases are
Not able to hear you, sir.
Some
Now,
glitches.
now
okay.
you.
I was saying that get it tested in the OPD IPD. Once you get a test, as Dr. Javeed has experience in IPD, in throughout his life he has got the confidence that yes, BEP, being electrical prostate, can be cured, whether it is supercritic acidification or normal acidification, whatever may be the condition. If we cannot, we have to strive and strive and study and study and study to find out the solution. But it is curable cases in homeopathy. I like to tell one experience of mine as I learned from my teacher that test and strive on the cases. In first year of NIH, deep NIH course, I was just going out to take some tea outside the campus. You might be knowing that exactly opposite to our NIH campus in Homoeopathy, there was one tea stall beside the post office. I found that one person coming, old person, carrying a usual bag in hand, and he was being carried by a young boy. I asked him, why you're coming this way? OPD getting in that side. This is official here. Identity get main gate. Then the boy told, আমরা জানি না, we do not know which one is the gate. We want to be treated here. He is my father. Then I got the interest. But what is the case? That Command Hospital, Army Military Hospital in Kolkata Eastern Command Hospital has refused my father for operation of prostate. We heard the name of this institution. We have come over here. And then he asked me from whom you heard it. I heard the name of this institution from Command Hospital. Just imagine. One doctor told us that you can try in homeopathy. There is one hospital in our hospital. You can try there. So immediately, for my own interest, I asked the patient to get one of the ticket under my name by which I can see. At that time, there was our senior's name, and I'll be able to see. I asked him accordingly. I took the patient to the registration department, make the card, and took the case history. Case was very interesting. That is the first case I've experienced in my life regarding prostate. Before that, I saw two our teachers in Calcutta Victory Medical College. Then patient told, in brief I am telling, uncontrolled hypertension, uncontrolled diabetes. He was a smoker all along. He was one forefronting fighter in army. For 3 years, he is suffering from multiple complaints. Ultimately, prostate enlargement. He was admitted to Command Hospital. They tried their level best to control the sugar and hypertension that was not being controlled. So naturally, they have referred the case to our hospital. Then I asked him, can we take admission? The boy is telling yes, yes. Sir, please admit him. Because it is not possible for us to maintain him in our home. I admitted the patient. Then after getting admission, I took detailed case history. There were multiple symptoms, definitely. But what I found astonishingly, starting from the first day when he was coming into our campus to the main gate, with his son, was completely expressionless. As if he was carried by his turn and coming to some other places. No tension, no anxiety. When I was taking case history, he was completely indifferent. All answers are being given by his son. Very few words he is replying. This struck to me that how a military officer be so much indifferent regarding a serious disease which has been refused from other hospitals. When I asked the boy, so, is your father is under shock or depression for the disease? The son is telling no, no depression, no shock. He is asking, talking, taking, asking for his favorable food, everything he is doing. Then he asked him, is your father is this type of indifferent? All I'll follow, no sir. My father was very active, very jolly, very commanding. All of our in our family members were scared of his commands. But recently, for few years, we have seen gradually he is becoming indifferent. Regarding his complaint, desire, wearings, etc. I have carried my father. My father was disagreeing to come because he has decided that he will die. Better to die at home. This stuck to my mind. You must agree with me that this symptom was typical of Arnica mountain. I gave him Arnica 200 in IPD. No response. Patient was completely same condition. No changes. It was taught by our teachers that when you see a patient, progress has been arrested. Patient is feeling little bit better in any way. Go on waiting, waiting and waiting unless the next medicine is called by the patient totality or patient symptom. Medicine is working. More deeper the disease, more it will take time. So depending on those, it is observation too. I was waiting. After a few days, what I found that patient is complaining of sister. Sisters are not doing this thing, not giving this thing, complaining even in the hospital. It was struck to me that definitely patient has started improving because mental complaints are improving. He is desiring something. Who was completely indifferent, now he's asking, complaining for other things. I continued. Then I asked Dr. Dabe and Dr. B.R. Mukherjee was our surgeon, both the surgeons, to suggest me what to do, to assess whether the patient is in static state or gradually deteriorating. Before that, I had all the reports of command hospital. I showed my teachers, Dr. Gopal Dabe and B.R. Mukherjee. They observed all the reports and the patient. They told that, see, the blood pressure is coming down. Did you give any medicine on or for did you give any medicine for hypertension? I said, no, sir. I gave only one medicine covering all symptoms. The uncontrolled hypertension is slightly less. He was continuing allopathic medicine too, means for diabetes and your hypertension. Still, that was not being controlled. There is little less in blood pressure was observed by Dr. Gopal Navi. He told me, wait, patient is not deteriorating, urine color is not changing, almost same color is coming out. Go on testing his urine every third day and wait. Let us see what happens. We will come frequently. Whenever you will call, we will help you. You will be astonished to know about after 7 days, patient started feeling that I am not able to bear this catheter. Can you do something to take it out? He was carrying, he was so much indifferent. Now he's feeling disturbed with the catheter, suprappubic catheter. For this catheter, by this time, Dr. Dabe changed one catheter. He is not ready to wear it. Then he forced him that he cannot take it out, otherwise he will die. After a few days, 3-4 days, suddenly sister complained that patient has bed weight. Automatic urine has come to urethra, which are not working for a few long days. I called Dr. Dabe and B.R. Mukherjee. B.R. Mukherjee used to come every alternate day. Gopal Dabe is our very neighbor and means our best guide and best guardian of A.M.A State Hospital. He was to stay in the your quarter of Marwari Hospital. He told suprapubic saturation was there. Patient was passing urine. He was provided urinary mug to urinate, and gradually started filling our blood with the catheter. Dr. Lab and Dr. Mohit, don't take it out immediately. Let us wait for few more days. About 12 to 13 days, after 12 to 13 days, suddenly one night, sister called me from our hostel. Our hostel was just above the IPD and on the veranda, backside of the A.M.A building. We used to stay in the veranda throughout our courses. So sister called, please come, patient has taken out the catheter. Immediately I ran, and I found that catheter is in the hand of the sister. Patient abdominal catheter opening is completely open. Blood and urine is coming out, dripping down. Patient is indifferent, no complaint. I asked him, do you have any trouble? No, sir, I do not know how the catheter has come out. So it happened so that during night there was some irritation. Suddenly he take it out by his own hand. So forcefully there was tear in the opening of the catheterization and started bleeding and urination. So immediately sister did something. We called Dr. Gopal Dave. He came at night. Such type of person he was. Observe the patient. He told, keep the patient on slanting bed. Means do not allow the urine to go in the peritoneal cavity. And he asked us to observe and the sister, please see whether abdomen is getting tight, tough or not, means peritonitis. Accordingly, bed was arranged. Patient started urinating through suprapubic open wound and urethra. Dr. B.R. Mukherjee came. He told it is surprising that such inflate catheter has been taken out by a patient during sleep. Unbelievably, continue your medicine. What medicine you are giving? Then I called him, sir, medicine arnica. Arnica, it is being given in the trauma. So, yes, sir. Then what happened? You'll be astonished to know. Almost unbelievable. Gradually, the opening, first bleeding stopped, then opening got reduced. Urine is coming through urethra and suprapubic opening. He was there for 1.5 months. After 1.5 months, suprapubic urination means surgical opening urination was stopped. Patient urinating with urge. His blood sugar was tested, it has reduced. Pressure was tested, gradually it has reduced. Patient was discharged from the hospital after 1.5 months. And I asked the patient to come on the day where Dr. Gopal Dave or B.R. Mukherjee will be there. After 15 days, patient came and he told that no more bleeding or urination from the urethra, suprapubic opening. I am urinating normally and feeling fresh. Again, he was given for medicine for the 15 days. After 15 days, he came and it was found the opening has been completely sealed without any indication of peritonitis. That means homeopathy medicine has made the pathology in such a way that there is opening. Blood, the opening was such a manner, fibrosis was such in a manner, and not even a single drop was able to go from the wound to the peritoneal cavity. This is homeopathy. Patient was given placebo, was asked to come after 1 month. After 1 month, he came. The B.R. Mukherjee examined the patient. He told, patient has improved, but there is fibrosis, attachment of skin, muscle, visceral peritoneum, parietal peritoneum, and urinary blood. Complete addition. Since when you are moving the abdomen, entire bladder is getting moved and patient is feeling urination. Then sat told, what you will do now? The same operation has become needed again. If you do not take out, release the bladder from this fibrous abdominal wall, the complaints will remain in other manner. You will not be able to hold the urine for a long time. Then I requested, sir, can you wait for something? Yes, you can wait, definitely. And fortunately, we found that sugar and pressure are coming down gradually nearer to the normal. Allopathic homeopathic medicine was simultaneously continued under the guidance of surgeons. Then after a few days, when patient came, we found that gradually the abdominal pain is moving. That means the additional fibrosis has become reduced. And ultimately, within 3 months, it was certified in writing the IPD cases that bladder has been released free from abdominal wall adhesion side effects has been dissolved and patient can urinate normally. There was sugar, there was pressure a little nearest to the normal. He was continued allopathic homeopathic medicine. But another after 3 months, it was found that patient was able to reduce the dose of sugar and pressure to a very good extent under the guidance of command hospital doctors. They saw the complete has come down, pressure, sugar is coming down, so that much of medicine is not needed. So this was the history of homeopathic medicine. This was the miracle of homeopathy in my first attempt to treat prostate disease. As I learned from my teacher, just see one case and get confidence that this case is curable. Since then till today, rarely I can remember the case of prostate enlargement did not get any improvement. That means, as Dr. Javeed was telling, Dr. Iqbal was telling that constitutional medicine, Pritha was also telling the report of research, constitutional medicine is the best solution. If at all necessary for the time being, we can use the help of organic medicine. But if we can identify uncommon people symptoms and give the medicine, the homeopathy medicine, miracles can happen. For the case I told you, it was published, and I am trying to give it in our e-journal. So, request to all the viewers, all on the skin, out of the skin, that prostatic enlargement is not at all a difficult disease for homeopathy doctors. If it is not being very late, if pH is very high, there is carcinoma, some other measurements should be taken by the modern system of medicine. But so long cancerous disease are not that much prominent in the patient, we can control safely. One more thing I want to tell you, this is my personal experience. What I do is, I ask the patient of BEP to urinate with an intermittent flow. That means urinate, then of your own stop it. Again urinate to some extent, then again stop it. I got a good result by this physical exercise with the intention that the muscles, prostate, will be thrust by circulation. They'll be healthy if they are under sudden thrust during urination. Bladder full, urethra full, deep sudden block. Then valves, urethral passage, prostate, they will be under exercise during urination. That is very good exercise. You can see in your cases. So anyway, nice presentation for the day, nice moderation and inauguration. Expecting all to this, they are about the prostate disease. Clear, get one PSA done, get one USG done, be confident that it will cure. We have many weapons in our repertoire and material. Okay, thank you very much for coming and joining with us and especially encouraging us to continue this journey. Thank you. One more, I think, I want to add that learned one thing, and you have also learned the same thing. That is, our history of homeopathy development is by the similar manner. They saw one case, get confidence, become great homeopaths. Starting from Hahnemann to who not, everybody. Kane, Farrington, seeing one case, they were Boniface changed his complete profession subject from botanist to become homeopath. So these strokes are very, very much important, like apple falling of Newton. We should welcome this type of experiences and encouragements. I think there is a network problem.
No, sir, we are able to hear you and really thankful to you for for sharing your knowledge.
So one more thing, what I want to tell you that intermittently we should get tested. USG done, treatment is going on. PS was done, treatment is going on. But after 2-3 months, get again another USG, another PSA. If we cannot find complete cure, but if we can, the growth has been restricted, or the growth has been reduced, volume or weight has been reduced, that is also efficacy of homeopathy. That should be also documented and presented to before all of us. Because if we cannot cure completely, if we can arrest or improve, definitely these are the achievement of homeopathy, which means documentary follow-up.
Definitely, sir. It is more to do with the quality of life of the patient. So if he is able to sleep better, so that is one of the most important things, I believe, for a patient who has to get up 2, 3 times, 4 times at night and not able to sleep, not able to be productive then. So in the subsequent day. So what you are saying, it is very correct that even if we are not able to cure him completely, because we cannot bring that balance back after a certain age, but with the improvement in the symptoms, with the improvement in that holistic manner, where the quality of life improves, that is very, very important for any patient, for any disease condition, for any patient.
Definitely. The first question, the second visit, usually what you ask the patient, Agni Kamon Achen, how are you? We don't ask what is about your abdominal component, what is about your compression of the IVR. We ask first question, how are you? This is homeopathy. The first question is, how do you feel? If you feel a little bit better as a whole, but all complaints remaining same, homeopathy medicine has started work. Sure, no doubt. So this is a very important first question, how are you? Isn't so? I think any question, not yet any question has come. Orko Bidyut, do you hear us?
सर दो ही चीजें हो सकती है सर.
Now it is. Bidyut is there. Our commander of Alumni have
Yeah. True.
really he's a tremendous sportsman spirit. He himself is a sportsman and inspiring all of us, all along.
Definitely.
Come on, Bidyut. He is successful by his name, Bidyut, sparking.
Sparking.
Is there any question, Bidyut?
You guys are not audible right now.
Most probably. There is some error.
सर अभी तक कोई क्वेश्चन नहीं आया सर.
हाँ.
I think we are done.
सर दो ही चीजें हो सकती है ना सर, या तो टोटली बोरिंग था,
हाँ बोलो.
नहीं
या तो सब
it was
समझ
very
आ गया,
nice.
या तो कुछ भी नहीं आया.
हाँ ठीक. लेकिन जो सिमिलर हुआ, इसमें
Very good presentation, and I think that there was hardly any doubt.
Decide.
Exactly. That's why there is no question.
Yeah.
Exactly.
Okay. Thank you so much, everyone. So let's end today's program. Yeah. Thank you. Thank you, Kalyani sir.
Good night.
Good night.
See you again.
Everyone. Yeah.
Okay. Thank you so much. Good night, everyone.
Okay.
Thank you.
Good night.
Thank you for your
Many
patient
thanks for coming with us.
Good night and thank you.